This virus is still having its way with society, and we have to remain vigilant to keep everyone mindful. I got a thumbs up. Is that a thumbs up, Sharon?
It is, yes, sir. And you are on board. I believe I have a quorum. We can start taking roll, and that'll confirm it.
Excellent, excellent. And you guys have learned over the year how to end my soliloquies. Just be on time for a meeting, and you don't have to hear me postulate for hours on end about aimless and sundry items. With that, we will jump right into our first meeting of the new year. Welcome back, everyone. Happy New Year. And I'll call it to order. It looks like it's 12:03, depending on what your computer clock says. Welcome to our COG Board of Directors meeting. This is your chair, and Derek Davis. And I'd like to call our board meeting to order, recognizing that this is, again, our virtual platform. We request your patience and ask for microphones to be muted. If you would like to speak, please make sure to unmute your line and then return to mute. Please take advantage of the chat box. I'm quite sure we all know how to use our chat boxes now. Here we are today in our WebEx format, not Zoom, not GoToMeeting, but WebEx format. So your chat box should pop up, and I think everyone's had pretty much a year of practice on using it. First, I'd like to lead us off in the Pledge of Allegiance, and then we'll move right into our second item. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Thank you all. It's a much needed pledge today. Okay, so today's meeting, our webinar audio and video are being live streamed on the COG website through COG's YouTube account. To facilitate quick Q&A or comments for our speakers as smoothly as possible during the meeting, there are two options. The first is to indicate in the chat function, as I talked about earlier, that you have a question. After those are facilitated, the chair will then verbally call for any questions from each state. This is a good time and a good moment for those who might be on our phone-only feature to ask their questions. During votes, after a motion to adopt a resolution is made and properly seconded, we will proceed to discussion. And after discussion, the chair will first ask for abstentions and nay votes. Remember, first we're asking for abstentions and nay votes. Please state your name and jurisdiction if you state as you state your vote. The rest will be counted as a yes vote. So abstentions and nays, I need your name and your jurisdiction, and all the rest will be counted as yes votes. Alas, as it is officially time to pass the torch as the COG board chair, it has truly been an honor to serve you this last year under these circumstances. It was challenging for all of us, and I am proud of the work that we have done collectively with regard to equity, with regard to housing, and being a leadership organization for the region. My last act as COG board chair, I would like to propose the creation of a new task force focused on the District of Columbia's statehood. This task force, made up of COG board members and chaired by myself and a Virginian, will study the initiative to attain statehood for the District of Columbia. While statehood has been top of mind for the district for a long time, this year has brought to light many inequities the district faces without statehood. For example, the distribution of the CARES Act funding that we made comment and we supported the district on, the authority of the District of Columbia to deploy the DC National Guard. I believe this is not just a priority for the District of Columbia, but a regional issue that deserves our attention. Approval of this task force will be on today's consent agenda, and I ask my colleagues to support that effort. Item number 2 is the official passing of the torch. Now I'd like to present to you the report of the COG nominating committee. of the nominations of individuals to serve as the 2021 COG board officers.
Mr. Chairman,
Yes, in that.
I apologize for interrupting, but before you take nominations and a vote, please finish the introduction, but if we could take roll, that would be great.
Absolutely. I tell you what, let me finish the introduction as our lawyer has said, and then we will take our official roll. So let me see, Sharon, we are at a place where we can go ahead and take that roll because I have a paragraph to follow. So let me ask our attorney to take roll.
Thank you, sir. I just want to make sure that whoever is inducted is official.
Absolutely.
With respect to the District of Columbia, I have Ms. Perry, Mr. Mendelson, and Mr. White. Is there anyone else for the district? With respect to the state of Maryland, I have Mr. Adams, Mr. Collins, Ms. Schaefer, Ms. Mitchell, Mr. Wu, Mr. Moe, Ms. Navarro, Ms. Jackson, Mr. Davis, Ms. Stewart. Anyone else for the state of Maryland? Hi, Mr. Harrison, I do see you. I apologize leaving you off. Anyone else from the state of Maryland? With respect to the Commonwealth of Virginia, I have Mr. Wilson, Mr. Dorsey, Mr. Meyer, Ms. Gross, Mr. Lusk, Mr. Snyder, Ms. Briskman, Ms. Randall, Ms. Wheeler, and Ms. Bailey. Anyone else from the Commonwealth of Virginia?
Mr. Wolf.
Thank you very much. Mr. Wolf, I do have you, sir. Anyone else? Mr. Chairman, you have more than a quorum. Thank you, sir.
Well, I thank you for that efficiency, Attorney Pandak. Appreciate it. As a matter of fact, as I saw my screen light up, I was kind of excited. I saw so many bright faces on our first meeting. Actually, I saw more than had confirmed their attendance. And so now we're all official and we can move right into our nominating committee's board for board of directors for 2021. You should see in front of you the proposed nominations. I'd like to thank the nominating committee for their time and the nominations for the COG board officers. The proposed nominations are included in Resolution R1 2021 and are as follows. For chairman, Robert C. White Jr. from the District of Columbia. Vice chairman, Christian Dorsey from Arlington County. And Vice Chairwoman, Kate Stewart from the City of Tacoma Park. Is there a motion to approve R1 2021?
Mr. Chairman, so moved, Chair Randall.
So it's been moved by Chair Randall and seconded by
Supervisor Davis.
Sounds like everybody who could unmute their mic will give that second to Supervisor Meyer, Mayor Meyer. Is that you out there? And let me call for, there's a motion, a proper second, any need for discussion? Seeing no need for discussion, I'll take abstentions. Are there any abstentions or nay votes? Seeing no abstentions, seeing no nay votes, the motion passes. Let me congratulate our new officers with a round of applause, a tip of the hat, and a pass of the torch to our new board chair, Mr. White. Mr. White, take it away.
Thank you very much, Mr. Davis. Before we move to our next item, I just want to recognize you for your service to the COG board as our chair from 2020. It was a more difficult year than any of us would have imagined, but your leadership really helped to navigate us through a difficult time, a time where we really needed to pull together and support each other. And I think you were the perfect person for this time. So I want to thank you. And on behalf of the COG board of directors and staff, you will be receiving by mail, for obvious reasons, the chairman's plaque thanking you for your service. So if we could all just take a moment to give a round of applause to Chair Davis for his service.
Thank you. Thank you. Thank you.
Moving to agenda item number 3, election of the 2021 Policy Committee leadership. I'm grateful to have the opportunity to continue working with all of you and serving as your chairman for this year. It is indeed an honor. As my first act as chairman, I would like to nominate the 2021 leadership of COG's policy and administrative committees, which is listed on page 7 of your board packet. I'll give you a moment to pull that up because it's a long list. On resolution R2-2021, this is approving the leadership of COG's policy and administrative committees. Is there a motion and a second to approve the 2021 policy and administrative committee leadership?
Moved. David Meyer, Fairfax.
I'm just going to pick one. I heard Phil Mendelson from the District of Columbia. Is there a second?
Yes.
Penny Gross seconds.
Okay, Penny Gross seconds. And that practice of saying your name first actually helps too. I have all these boxes. So thank you, Penny Gross, for seconding that. Are there any abstentions or nay votes? Hearing none, the motion passes. Moving to agenda item 4, the chairman's report. To start today's chairman report, I want to take a few minutes to talk about the priorities of the COG Board of Directors in 2021. I'm, again, honored to serve as your newly elected chair. And while I know we're going to go through a challenging time, I also know that working together at COG makes a real impact for our communities. Next month at our February meeting, I will expand on additional focus areas for the year. Today, though, in light of all that's happened over the past week, I want to focus on the events and their impact on our region. The attack on the U.S. Capitol, which is in COG's backyard on January 6th, was profoundly disturbing. It was a blatant attack on democratic ideals. Inciting of violence by those entrusted with leadership is unconscionable. And it's a reminder to all of us about what the responsibility of leadership really is. The shocking disparity in the federal response to this riot when compared to the Black Lives Matter demonstrations in June laid bare some of the hard truths about how much race plays into law enforcement response. Race-based threat assessments led federal law enforcement to use rubber bullets, chemical projectiles, batons, shields, and helicopters to respond to Black Lives Matter protests this summer. But to treat last Wednesday's mob as a simple First Amendment protest, despite members of radical groups publicly indicating their intent to harm members of Congress and forcefully overturn a democratic election. The same assessment has led to the murders of too many unarmed African Americans across this country. Watching the events unfold last Wednesday was a scary time for all of us who value democracy and peace, but it was a triggering event to many people of color who are familiar with the racial disparity we saw play out. I'm doing some work on this in DC to study race-based threat assessments, and I personally encourage my colleagues in the region to do the same. Despite the failings, however, the rapid response by state and local elected officials, city and county managers, police and fire personnel, emergency managers, and 911 dispatchers from the District of Columbia, Maryland, and Virginia greatly aided in the restoration of order and allowed the work of Congress to proceed. And I want to give a special recognition to Mayor Bowser and to our police chief, who really took command of a dangerous situation in a necessary time. I also commend, please, I do give her a round of applause. I commend the mutual aid and collaboration demonstrated by our region, by our region's network that we work hard to create. As the executive committee noted in our statement last week, in times of crisis, real leaders demonstrate courage, collaborate, and lend aid. They don't stoke division and chaos. Public safety is a major part of COG's work program, and as we advance our focus on equity, we will engage with our police chiefs committee and with law enforcement agencies on how to further leverage our network and connections to help spark much needed change. Following up on our work in 2018, I would also like to continue our examination of best practices for public safety of local government buildings throughout the region. Looking ahead to the coming week, Mayor Bowser, along with Governor Hogan and Governor Northam, have requested that constituents celebrate the inauguration from home. That is to say, please do not come to DC. I'd like to commend Chair Randall for her leadership on messaging in advance of January 6th. Unless I hear objection, I'd like to direct staff to issue a statement on behalf of the COG board in support of this messaging. We hope colleagues will help share this messaging through their own channels. I've heard no objection, so I think COG board staff should move ahead with that messaging. As Councilmember Davis noted, the COG board will be voting to create a task force on DC statehood, which will study, among other things, the issue of enabling local control over the DC National Guard. I know you all will support me and the executive committee as the COG board tackles these issues of vital importance this year. Moving forward to new COG board members, I would like to take a moment to welcome a new COG board member, Councilmember Denise Mitchell from the City of College Park. Welcome to the COG board. Would you like to introduce yourself so we can all, those who don't know you, can get to know you?
Good morning, Mr. Chairman. Again, my name is Denise Mitchell. I'm a City Council member from the City of College Park. I have served as elected official since 2009, but took a break in 2015 and came back in 2017 to present. I currently serve as the alternate to the Transportation Board, and I really look forward to working with each and every one of you this year. And thank you again, Mr. Chairman, for allowing me to speak.
Wonderful. Thank you. Welcome again. I would also like to welcome Tara Jackson, the new alternate for Prince George's County Executive Angela Also Brooks. Welcome to the board. We look forward to working with you both. The 2021 Board and Policy Committee meeting dates, I would ask that you review those. Those are on page 10 of your packet. And I want to make sure that the COG board meeting dates are saved on your calendar. So please do take a time to review those dates and plug them in. Also want to make a note about COG's Town Hall series. This month's event on Friday, January 15th, concludes the COG and the Transportation Planning Board's virtual Town Hall series, leaning into 2021, more equitable, more resilient. I hope those who joined previous sessions have been able to take advantage of the ideas and insights provided. And if you haven't already, don't forget to register and spread the word about Friday's Town Hall to your colleagues. For more information, please see page 11 of your packet, and I'm sure you can see COG's social media for information that you can forward along as well. Moving right along to item 5 on the agenda, the Executive Director's Report. I would like to turn it over to Mr. Bean to give his updates for the Executive Director's Report. Mr. Bean.
Thank you, Mr. Chairman. Given the immediacy of the day, we're going to hit just 2 things. I'm going to ask our Director of Homeland Security and Public Safety, Scott Boggs, to provide a brief update, mutual aid operations plans, and secondly, inauguration planning. So, Mr. Boggs?
Sorry, getting off mute. How's my audio?
Good.
Okay, first, Mr. Chair, appreciate you recognizing the coordination that occurred on the extraordinary events on January the 6th with our public safety partners in the region. With that, I wanted to give an update on mutual aid agreements and operational plans. The first one is the mutual aid agreement that was signed and executed in 2005 is the agreement that allows us to share resources in the NCR, and that includes our law enforcement resources. The Police Mutual Aid Operations Plan is a plan for how we share law enforcement resources in the NCR. The 2017 plan is still in place, and the current update is in its final stages. One final edit for the District of Columbia. Those revisions still in progress do not impede our ability to provide mutual aid, to plan for mutual aid for those planned events, or the execution of mutual aid support to provide means the means of additional resources where needed. I'm going to shift to the security planning. Security planning through the inauguration has been ongoing, and many of your subject matter experts have been meeting and collaborating on these. The emergency managers met on Wednesday, January the 12th, to discuss the events that have potential impact in the region up to and even after the inauguration. The police chiefs have met on Monday, January the 11th, to coordinate resources and to assist the Capitol Police to ensure we have the appropriate operational resources and posture. We continue to coordinate with others in the region in preparation for the inauguration and the events leading up to the 20th and after. This includes groups like Mass Care and Emergency Assistance and sharing things like family reunification plans. The transition to the National Security Special Event is today. This means that a committee of participating agencies led by the Secret Service is now overseeing things like the operational posture and resource requests. I'll also note that we are planning a meeting for the Homeland Security Executive Committee, the Chief Administrative Officers, and a briefing for the Emergency Preparedness Council on these events. With that, I'll turn it back over to you, Chuck.
Thank you. So the last three meetings that Mr. Boggs mentioned happened tonight and within the next 48 hours. I think with that, Mr. Chairman, I'd like to turn it back to you.
Thank you both. Moving to agenda item 6 on amendments to the agenda. Are there any amendments to the agenda at this time? Hearing none, we will move to agenda item 7, approval of minutes from the November 12th, 2020 meeting. Is there a motion and a second to approve the minutes from the November 12th, 2020 meeting?
So moved.
Chuck and Monica, I may need help with that one. I heard several voices and could not catch any of them.
This is Penny Gross. I move to approve the minutes.
Thank you. It's been moved. The measure has been moved. Is there a second?
This is second.
Tim Adams, second.
Give it to Tim, Robert.
Thank you. You were so good. You made this look so easy, Derek. I'm like, how did he know who was talking? All right. Thank you. Seconded by Tim Adams. Are there any abstentions or nay votes? All right. Hearing none, the motion passes. Moving on to the consent agenda. We have 7 resolutions on the consent agenda for today. I'm going to give you a moment to just look through them if you have not already.
And as we make the as we wait for the motion, I'll make the motion to move this favorable.
Thanks for making that easy, Mr. Davis.
Penny Gross, second.
All right. We have a motion and a second. Are there any questions from members from Virginia?
I have a question.
Yes, Ms. Randall.
So one of the items on the consent agenda is the resolution authorizing the creation of a task force to study DC statehood. And you said that you've already chosen somebody from Maryland. How was that person chosen? And can I put myself forward to be the person from Virginia?
Good question. I love the enthusiasm. I'm going to kick this over to Mr. Davis.
Ms. Randall, I welcome your participation on the committee as well. I'm checking to see if Mr. Dorsey had also been petitioned. I actually established it and placed myself on the committee as chair. It was somewhat of a fiat, but the work that we've done together, Christian, shall we?
If Christian's on it, that's fine too. But I was happy to put myself forward. But if Mr. Dorsey's already got there, so that's okay too.
I am there, but I promise to keep my. I am there, but I do promise to keep my colleagues, including the very enthusiastic Chair Randall, deeply informed of all of our deliberations.
Thank you very much.
There's no shortage of work to do, so I'm glad we have so many volunteers, and I appreciate it. I know my colleagues from DC do as well.
Thank you, Mr. Chairman.
Thanks. Are there any other questions from members from Virginia? And this is on the consent agenda. Any questions from Maryland, members from Maryland? Hearing none, are there any questions from members from the District of Columbia?
Mr. Chairman.
Yes, Ms. Perry.
I would just like to make a comment and thank Maryland and Virginia for their enthusiasm about studying DC statehood. I would also like to say, in the course of your studying, we're hoping that it will be on the 100-day agenda. We know that's optimistic, but you know, you got to shoot for the sky. So I just wanted to impart that while you all are really enthusiastic about it. So again, thank you. And we look forward to all of your help.
Wonderful. Any other questions from the members from the District of Columbia? Let me just join Ms. Perry in saying thank you. Regional support for this effort means a lot, and it's particularly important. With no more questions, seeing that there are no more questions, I want to call for a vote. I'm sorry, we need a motion and a second. Is there a motion?
So move, Supervisor Bailey.
Thank you. Moved by Supervisor Bailey. Is there a second?
You have Mr. Harrison?
Mr. Harrison, there we are. Thank you, sir. Are there any abstentions or nay votes? Hearing none, the motion passes. Moving to agenda item 9, the audited financial statements. I would like to invite COG Audit Committee Chair David Meyer to brief us on the FY20 audit report presented by PB Mayers LLP. A link to the full financial statements is in your board packet under agenda item 9. The board will be asked, just so you know, to adopt resolution R10-2021, accepting the FY20 audit and authorizing the selection of the independent audit firm's contract to perform the FY 2021 audit. So with that, let me turn it over to Mr. Meyer.
Oh, thank you, Chair White, and my congratulations to your appointment this year. The audit financial and compliance reports for COG for the fiscal year ending June 30, 2020 were presented to the audit committee on December 3, 2020 by partner Mike Gaber of PB Mayers and Mike Garber, I should say. A link to the report is in the board packet, as you noted. Now, there are two parts to this audit report, the financial section and the compliance section. The auditors have issued an unqualified and unmodified clean opinion on the basic financial statements, confirming that COG's financial information fairly represents its financial position. The auditor's required communications to the board of directors has been provided on a separate document and can also be accessed from the link on page 26. The auditors also issued an unmodified opinion on the internal controls and compliance on the schedule of expenditures for federal awards. A letter to management alerts to upcoming changes in financial reporting was also reviewed by the audit committee. In January of 2020, the COG board approved RA 2020 authorizing the solicitation of proposals from independent audit firms to perform the FY 2021 audit. The audit committee reviewed the top 3 finalists that were the top 3 final rated proposals. Based on this review, the committee is recommending approval of resolution R10-2021, accepting the FY 2020 audit report and selecting Clifton Larson Allen LLP to perform the FY 2021 audit. And the resolution for this is on page 27 of the board packet. And in closing, I would like to express my appreciation to my colleagues on the audit committee, Brian Feldman from the Maryland State Senate, Emmett Jordan, our vice mayor of the city of Greenbelt, Patrick Rohan who's the mayor of the city of College Park, and Hector Sindages from the Manassas Park City Council for last year's audit committee. It's a pleasure to work with these colleagues as well as the professional staff here at COG and Julie Massong, who is our CFO for COG. I want all the board members to know that the financial management of COG is in good hands, and this report affirms those the results of the audit and the good financial management that COG practices each day. With that, I will entertain or request that the board make a motion to accept the audit report.
Thank you, Mr. Meyer. We'll now facilitate questions from any board members. Are there any questions from members from Virginia? Any questions from members from Maryland? Any questions from members from the District of Columbia? All right.
Mr. Chair, I move adoption of Resolution R10 2021.
Second.
Thank you. Ma'am, who seconded it? I heard it.
Wolf.
Mr. Wolf, there we are. Thank you very much. We have a motion and a second. Are there any abstentions or nay votes? All right, hearing none, the motion passes. Moving to agenda item 10, legislative priorities. COG continues to focus on advancing our legislative priorities and relationships with state and federal elected officials. Today, COG Government Relations and Member Services Supervisor Monica Beruti Nunez will present the proposed 2021 legislative priorities on behalf of the Legislative Committee. First, I would like to turn it over, though, to Vice Chair Dorsey, who chaired this year's Legislative Committee, to offer comments.
Thank you very much, Chair White. So the Legislative Committee had a robust conversation during the month of December. We had several very helpful considerations which further strengthened the document that you see before us. There was also an exploration of a survey that was done by COG staff to see whether or not we should prioritize any greater work in police accountability and best practices. The good news from that investigative work is that the region is already very much at the progressive forefront of best practices in policing. If you are familiar with the 8 Can't Wait initiative, we surveyed our region's jurisdictions and found that all of them are well ahead in implementing those robustly as part of their policy. So the legislative priorities that you see before you really reflect, areas where we absolutely, as a region, know we'd like to see progress in the year ahead, and are also stress tested among various members of the committee to be achievable. Not that they will be, but we know that they are realistic. So I commend the work and very much appreciate COG staff, specifically Monica Beruti Nunez, for their work in putting it together.
Thank you, Vice Chair. So the legislative priorities being presented today are on page 29 of the packet if you would like to review them in detail. Today I'm going to provide an overview. The COG board uses these policy priorities throughout the year, especially with our policy committees, to advocate at both the state and federal level. And these are also meant to be specifically advocacy related. So these are in no way a total coverage of all of COG's priorities or projects, but we really try to focus them in on advocacy related issues. This year, you'll see up front an added focus on the federal COVID-19 funding. And there's also COVID-19 different related issues added throughout each of the priorities. You'll also find an overarching theme of infrastructure investment, equity, and increased local government input throughout. We're divided into 6 broad advocacy issue areas. The first is supporting transportation funding, planning, and connectivity, specifically fixing the deficit in the Federal Transportation Trust Fund and dedicated funding for Metro. Also supporting funding for next generation transportation systems and improved traffic incident management. The second issue area is water quality protection. It's focused on supporting investments in water infrastructure, water quality, and the Chesapeake Bay program. The third is climate and energy innovation and air quality protection. The priorities under this category specifically focused on increased investment in clean energy sources and expanded funding and legislation to meet the region's climate change goals, including the Transportation Climate Initiative. The fourth category is housing and economic resources. This includes increasing the supply of housing, promoting housing affordability, and efforts to end homelessness. The fifth section is health and human services. This includes efforts to combat substance use disorders, increased access to mental health services, and an increased focus on food security, healthy food access, and regional food systems. The sixth and final category is homeland security and public safety. In addition to emergency preparedness and urban area security initiative funding, this year we've added 2 new priorities to this section of great importance focused on infectious disease preparedness and cybersecurity preparedness. So all of these priorities presented in front of you today have been put forth by the legislative committee, and pending approval will be shared at the federal and state level and continued to be used by COG staff and policy committees throughout the year. Happy to answer any questions as the board considers approval of Resolution R11.
Thank you very much to both Christian and Monica. Are there any questions on the legislative priorities?
I have.
Yes, Ms. Randall.
Yes. Thank you, Mr. Chairman. On page 32, under the dedicated funding to Metro, hold on. It says to Metro's capital improvement budget, and the last line, budget at or greater than $150 million per year. The $150 million per year is what they're giving us right now. And I have said and will say again that I don't believe that's enough. And so I believe we should take out the words at or and just use and say the budget greater than $150 million per year. They're giving us that now. We have no reason to believe that's there. But as we've said many times, Metro moves the government's workforce, and there are localities as much as Metro pays is. I believe that the Metro should be given double at 300 million. So I believe that the words at or should be removed, and it should just read greater than $150 million. And then my second question is the traffic incident management. That was so. How would you like counties to help with that? Because we in Loudoun County, we put that bill forward in our General Assembly twice now, and it did not pass, and we did not get a lot of assistance. And I think this being in COG's legislative package, if we can get a letter from COG and talk about that, what it means to the region, not just to Northern Virginia, that would help. Probably not this year, because we're not going to put it forward this year, but next year, as far as our legislative package. And then finally, I know that there's COVID requests all through, but is there any one place where it says that all federal money that is given for COVID relief funds, we want some dedicated revenue to states and localities?
Mr. Dorsey, can you or someone from the legislative committee respond to that?
Yes, thank you, Mr. White. So as to the first piece with Metro, I think we certainly all agree that 150 is the baseline and would in fact like to see more. While I think your sentiment, Chair Randall, is widely felt, for the purposes of this document, I'm wondering whether we need to change the wording since what you intend is actually conceived of in the writing, and if there's some other way that we can strengthen it. Part of the issue is that while many of us as priority users of Metro understand and fully believe this, we have not yet fully gotten wide buy-in across all players in the region. So we don't want to have this document scare folks off. So that's just one initial response to that. The third piece that you brought up in terms of COVID, I do believe, and Ms. Baruti Nunez can help me, but I do believe that is specifically called out for aid to states and localities. So I think we've got that, but I'm going to rely on Monica's perspicaciousness to validate that. And then traffic incident management. It doesn't seem to me that there's any reason why COG can't further support the efforts of localities by doing just exactly as you asked. So we'll figure out and work with you on what form that should take.
Thank you, Mr. Vice Chairman.
Thank you. Are there, yes, Ms. Bristman.
Thank you, Chairman. What we don't see in here, and it's probably maybe putting the cart before the horse, but I just wanted to comment that with the task force that will be investigating DC statehood, I would hope that we would eventually have that in our legislative agenda. And also, since this is going out the door, perhaps we consider any sort of recommendations from that task force to go out, before next year's legislative agenda to our colleagues on the Hill to dovetail off of Councilwoman Mitchell's comments. I think it is imperative that we speak in one voice and loudly in support of DC statehood, and do it if we need to before this goes out the door, but definitely include it in next year's legislative agenda as well.
I will note that it not being in the legislative agenda doesn't mean that it's not something that it doesn't mean that we won't prioritize it. And so, yeah, I wouldn't read too much into it not being in the legislative agenda, but I would ask the legislative committee if there is if it needs to be amended, or if you agree with my thoughts on this.
If I could, Mr. Chairman, I would say I agree with your assessment there. I think it's going to be a clear priority since we're setting up a task force, and I believe that the marching orders that Mr. Davis will put us all under is to conduct that work very quickly, yes, well in advance of consideration of a next year legislative agenda. So, if there is momentum in the 100 days of the Biden administration, our voice can be heard with some substantive work on that. So that's my understanding.
Wonderful.
Robert, I was just going to add, and Chuck probably could, we've actually looked at an administrative timeline, and without pushing too hard, we're trying to be done by March.
Yeah, I like that.
Okay, thank you so much.
Thank you. Are there further questions? All right, I don't see or hear any. Chuck and Monica, do you see any? Good to go? All
Good.
right.
So, Mr. Chair, this is Mr. Davis. I'd move favorable on Resolution R11, 2021.
Thank you.
Second. By Christian Dorsey.
Thank you. Moved and seconded. Are there any nay votes or abstentions? Hearing none, the motion passes. Next, we'll move to clearly important and timely subject matter of vaccine distribution. For this conversation, we are joined by Loudoun County Health Department Director David Goodfriend, who will brief us on the status of the COVID-19 vaccine distribution. I'd like to ask Mr. Bean to introduce Mr. Goodfriend.
Thank you. I'm introducing Dr. Goodfriend in the context of some of the other supportive committees that your staff are working together through COG. One is the Chief Health Officers Committee, which has been meeting on a weekly basis. In addition, the Chief Administrative Officers are focusing on vaccine logistics, emergency managers, public information officers, as well on messaging to populations that might be vaccine hesitant. So that's a little bit of the infrastructure, but at the core is the Chief Health Officers. Pleased that Dr. David Goodfriend has been a very active member of the Health Officers Committee. Also, I think noting on the last discussion, the COG Board Executive Committee sent a letter to federal partners calling for a vaccine distribution strategy that supports the metropolitan Washington region's needs. So we'll continue to communicate our region's needs to our federal partners as needed. And with that, please, Dr. Goodfriend.
Hi, good afternoon. It's David Goodfriend. It's good seeing some of my elected representatives again, and for many of you for the first time. So thank you for inviting me. And this is very timely for two reasons. One, on February 2nd of 2020, and I know it seemed like a very long time ago, but that was when the enhanced surveillance started at Dulles International Airport, which kicked in the start of Loudoun County and our region's response to coronavirus. We had been tracking it for a while, but that was the first time that we, as a region, had to be prepared for the quarantine and isolation of individuals coming into the United States who may be suspected of having COVID-19 or coronavirus. So for all of us, we were well prepared for that. We had our isolation and quarantine policies in place. We've utilized them in the past for SARS, for Ebola, and others. And then again used it when that started with Dulles Airport, originally from China, with folks from China, and then from other countries as well. We then moved into the issues of testing and how do we get tests to people who need them. And as I'm sure you know, as we do, it was always a challenge of coming up with strategies to get sufficient tests out there in the community and getting them to the right people, and particularly those who may not be insured, may have less access to healthcare, may have more suspicion of coming in contact with the government. And that was at a particular time where our essential workers, who were disproportionately persons of color, were getting impacted. And then going into the summer, where our cases really started going up, and public health had to really try to figure out how do we keep on top of these case investigations and contact tracings to keep numbers down. And then really that fourth piece now being, how do we get the vaccine into the arms of people who are in most need? And that has been defined in a couple main ways of, how do we keep our healthcare delivery system afloat, and how do we minimize deaths, hospitalizations, and other morbidity in the community. So in addition to our isolation and quarantine plans that we implemented, we all have mass vaccination plans that we have and that we've revised to a COVID environment. I can speak well to what's going on in Loudoun County. I can speak somewhat to what's going on in Northern Virginia, but I'm much less fluent in what's going on in the district and in Maryland. But one of the great resources we have in Northern Virginia is the cooperation and collaboration with our Northern Virginia health departments. We've been meeting, originally it was every day of the week at 7:30 in the morning. Now we've at least cut back to every weekday at 7:30 in the morning, so that we could have a coordinated approach to coronavirus. And for me, that's been very helpful as we are able to pick the brains of all of our resources, which is probably about 100 years of public health experience. Also in Loudoun County, I think we were one of the first emergency operations centers to open, I believe, and our elected officials can correct me, by far I believe this is the longest time that our emergency operation has ever been open in response. And that really has been essential for us, as we do in Olive County, approach to addressing the need. So with vaccination, it's been going on since December. As you know better than me, It started with a three-pronged approach. We have our federal partnership with the long-term care facilities, with CVS and Walgreens going out, starting with the skilled nursing facilities, and then the assisted living facilities, providing initial and then booster doses of vaccine. And that's coming along well, particularly those folks in the assisted living facilities. They're getting a little antsy as to when they're going to come and start vaccinating them. But the process seems to be going well. The residents have had a very large uptake of that vaccine, which is terrific, in the 90+ range. Staff, anecdotally, is in the 60 to 70% range. And so that's a challenge for them, but at least if part of that is hesitancy, the staff have a better ability to access vaccine through other means later on when they do realize that it is safe and effective. Related to that has been because a lot of the staff at long-term care facilities are individuals of color and are essential workers. At least in Northern Virginia, we've been working very hard on a communication campaign, initially starting with testing for our vulnerable populations. But I think that helps us build that trust so that when we go out and talk about vaccinations, it's effective as well. The second leg was our hospitals that were vaccinating hospital personnel. And they've since, to one extent or another, throughout our region, been able to expand beyond their doors to the community. And then the third was the governmental part, public health in partnership with our county and city governments vaccinating. And that's where we see a lot of differences. But we expect that because every jurisdiction is different. We have some that are much denser populations and others, such as Loudoun County, that's less dense and differing demographics. So for all of us, we've the 1A populations, which were the healthcare providers of long-term care facilities, I think went pretty smoothly. There were discrete populations that we knew about and relatively smaller populations. The 1B group, which all of Northern Virginia entered into on Monday, which I'm proud of, that there were only 11 jurisdictions in Virginia that moved forward into 1B, but 5 of those 11 were Northern Virginia. But it was a challenge because there wasn't much time to prepare the community for going into phase 1B, what that meant. And particularly what we're finding is for those bulleted essential workers, the 9 different groups of essential workers in 1B, there's a lot of gray area in that of what's food production and what's not, who are the officials that are essential to government. And so at least in Northern Virginia, again, a value of us meeting every day is when we get into those gray areas, we talk about it and try to come up with a consensus where it isn't straightforward. So that's one piece is I think all of our call centers have been overwhelmed, probably starting with Saturday, but definitely on Monday, with people calling, people emailing, trying to get in for vaccine and trying to figure out where they fit. And so that's been a challenge for us in Loudoun, as probably it has been throughout. And then, for example, as you all have heard, when the federal government starts making differing recommendations, so when the federal government says, well, maybe it's not 75, maybe it's 65, that sets off another wave of folks being interested in vaccination. So we are trying to deal with that, where we wait to see whether Virginia changes. There are differences between our states and the district for some of these answers. And so that's some challenge for particularly for those jurisdictions that are closer to others. And then the last piece of that is the frame that that we've been hearing over the last week or so of delays in getting shots into people's arms. And I think that's part of the move up of going into 1B. We definitely are ramping up to meet that challenge. There are some concerns going forward, part of which we may not know until the new administration comes in. One of those concerns is for those people coming up for their booster shots. So there's been discussion that the federal government should release all of the vaccine to the community so that everyone can get at least their primary shot. If we do that, at least we'll have a good amount of vaccine to be able to provide. The concern right now is as we're all ramping up, the vaccine supply might not keep up. If they release those second doses, that may address the need in the short term for additional vaccine, but at the cost of now having some frustrated folks who aren't going to get the booster shot they expected to get. And then when that's used up, then we have all those primary and secondary folks, those 1A folks and the 1B folks looking for their booster shot that may not be available to them. So I'm not sure at this point whether a ramp up may or may not be sustainable once those second doses come out. The other piece is the equity piece, because we know that it's a lot easier for people with internet access, with education, with time and means to call up and make an appointment, to go online and make an appointment, to navigate the databases that we use. And as we're focusing on shots in arms, it's a little challenging to also make sure we're not leaving folks behind. So that's also something that we're acutely aware of. And as we get into our 75 plus population, we have to also be acutely aware, are our vaccination sites ones that are conducive to people who may have disabilities, who may have mobility issues, who may have cognitive issues, who may need caregivers to go with them, which really we didn't have to worry about with 1A. And we're doing that at a time where there may be ice storms, snowstorms, et cetera. The other thing that we're working on very hard is finding partners. So we've been working with local pharmacies, the chain pharmacies that have interest, large medical providers, our FQHCs, to see which of them are interested in providing vaccine. Because again, at this point, there were the three main sources providing vaccine to the 1A group. The goal eventually is that people should be able to go to their local doc, their local pharmacy, anywhere they would normally get a flu shot, get your COVID shot. And that's one way of helping with the equity concern. Rather than having to everyone find a way to come to our site, how do we let them go to their normal giant supermarket where they go shopping and also get it at the pharmacy there? So we've been in those discussions as well. And I think that's a long way of saying, it's been an interesting year. It's going to be, as I said, a full 12 months and a couple weeks. At each stage as we went through it, there have been challenges, and there's been public concern of why aren't we meeting the demand at the time. And I think we're definitely experiencing that now. But there are going to be other and differing challenges going forward with vaccine. We're all committed to trying to get vaccine as quickly into people's arms, as safely as possible. And particularly, how do we keep our healthcare delivery system intact? How do we reduce death? How do we reduce morbidity? How do we get kids back in school? And at least in Loudoun County, getting teachers and staff vaccinated is an important means of getting those kids back into public schools. And I'm happy to take any questions or address any concerns that you all have.
Thank you very much, Mr. Goodfriend. I saw Mr. Snyder has a question.
Thank you very much. And first of all, I'd like to thank all of our public health folks who have been dealing with incredible challenges. So thank you for the work that you're doing. My question goes to this, and to ask this group whether it might be appropriate to call upon state and federal officials to ramp up the vaccinations. And in my view, we're really not going to solve this until, as David Goodfriend mentioned a few minutes ago, these vaccines are available in at least the outlets where you can get your typical flu shot, your doctor, your urgent care, the hospital. All of those other outlets, many of which are in the private sector, are really going to be the solution to this. There are simply limited capabilities within our public health departments to move as rapidly as I think our public is demanding. So I'm wondering if there might be some generic direction from this board to request our state and federal officials to address this, how to ramp up production and how to ramp up the ability of the private sector. What do they need? How do we support them to get the supply, to get the vaccinators out there? Certainly to support our public health people, but to move in the direction of very significantly expanding the sources of vaccinations for folks. So I'm just putting that on the table. The more that I look at this, the more that I think, whether we like it or not, there are limitations to government's ability to solve this. And we very much need to mobilize, support, and do whatever it takes to get the private sector fully engaged in this in a way that's beneficial to them and to us. Thank you very much.
Mr. Chairman, I'd be happy to respond.
Please, thank you.
I think appreciate Mr. Snyder's point, and I think to the extent that this is a technical or medical matter, I think we would rely upon the chief health officers. When it's a logistical matter, the CAOs. I think he's expressing more of a political point, and I think as a process, if it's the will of the board, the executive committee could take such action as Mr. Snyder is prescribing, and staff would endeavor to get the input of the health officials to make sure that it's on target.
Thank you very much. Are there any other questions for Mr. Goodfriend?
Mr. Chair.
Let me go to Councilmember Navarro.
Thank you, Mr. Chairman, and congratulations to you and our other officers. I definitely want to support this sentiment. I know that what we are facing, for example, in Montgomery County, is a challenge vis-a-vis the amount of vaccines available. And there is no doubt that we need to find a way to engage our private medical practices, as was stated, any kind of outlet where people get their flu shot, et cetera. All of this needs to come together. But one of the challenges we're facing, at least in our county, is that, whatever we have received, we've been able to deploy, but it's clearly not enough. And to the extent that we can, as a region, send some type of, make a statement or request that the vaccine production obviously be ramped up as much as possible, and that we also have these very different outlets helping us, that would be really, really critical. It is true, our local governments don't have the capacity to, alone be able to provide, distribute, get the shots into people's arms. And it is going to get more and more of an issue. We have also discussed this issue of how do we get, the equity issue as well, and mistrust that exists. But for some reason right now, what we're facing more as a barrier, it's a lack of access to the vaccines themselves. So I think we can find some commonality in some of these barriers that all our jurisdictions probably are facing. And we also look forward to learning from some of our neighbors like Northern Virginia in terms of what they're doing. But we have to do this as one, because as we've always stated, in something like this, it's a virus, and if one jurisdiction is able to deploy but another is not, everybody travels, and we're all going to be affected. So I just really want to support this notion of finding out a way to send a message that is coherent and unified in terms of availability of vaccines. Thank you.
Thank you very much, Mr. Elric.
Thank you. I just want to chime in on a couple of things. The first is this notion that we can ramp up production. It's not the government's not producing anything, and whatever's being produced is being produced by the private sector. And while they apparently are ramping up production, I saw there was an agreement between, I think it was Pfizer and Moderna to produce more. That is not something we control, let alone at the county level. We certainly don't, and they don't even control it at the federal level. So unless the president were to use the War Powers Act to require production and mobilize resources that could do the production, we're not going to get the production. So I'm very leery about putting things out publicly and claiming we can do stuff and then having people get very angry at us for not doing it. So, it's nice to talk about it and it sounds good, but I'm not going to hang my hat on convincing them to increase production. The second thing is I completely agree about doctors and clinics. And I'm going to ask the governor if he can just frankly draft them. They ought to be mobilized. We've got so many clinics, and I know the other counties, you've got these private clinics that are out there in the community. They're sort of like the emergency health facilities. We need to mobilize them. It should not be a voluntary thing. I think about people who get drafted into the Army to go protect the country because it is essential. Drafting these facilities to help protect the residents is absolutely essential, and I think we need to do that sooner rather than later. Nancy is dead right. Our ability to vaccinate everybody or ramp up at the scale that's needed is really, really going to be a challenge. And we were talking about this on a call today. Right now, if you handed me 12,000 vaccines next week, 4 weeks from now, if I want to keep vaccinating 12,000 people a week, I need 24,000 vaccines. And if you gave me 24,000 vaccines, 12,000 would be for new people. I've got a senior cohort of over 70,000 people. So with 12,000 vaccines, it's going to take me 6 to 7 weeks just to get through the people 75 and older, because half the vaccines have to go to other people. I'm interested in this issue about the possibility of single doses, but I'm worried because some people have reported back that because you get a lower level of protection, you may give people a false sense of security. And they may think they're safe when they're not safe. They may stop wearing masks. We've all struggled with the rigor of maintaining the level of discipline we need people to maintain. I am terrified of the day that somebody says, I'm vaccinated, I'm okay. We already know, or at least we think we know, that you can actually possibly get infected again and spread the vaccine, but they thought with 2 doses it would be a mild infection. We don't know with 1 dose whether it's a mild infection or a bad infection. So we've got to be very careful about how we promote this until there's science that actually says, go for it, this will work. I know Moderna is running a test right now on whether the vaccine's effective at half the dose that they've put out there. And if it says it's effective at half the dose, that would be great news. But I'm not going to promote half a dose until somebody comes back and tells me this is going to work. And the last thing I think is, just getting platforms that work for mass communication. I mean, how we're going to register and prioritize the seniors at 75 and over, and then the 65 and older. We have struggled with data platforms. I know the state has struggled with data platforms. We have not been able to get a smooth flow of data from what comes into our offices or the state offices and then back out again. So if we're going to register people, we've got to be sure we can communicate with them, and then we can actually assign them slots, which is even more complicated than registering for an update. Registering for a slot in a vaccination program with multiple sites around our counties is not going to be an easy logistical thing. So we're going to need help. That's my 2 cents on this.
Thank you, and duly noted. Ms. Gross.
Thank you, Mr. Chairman. couple of things. There are multiple languages in our region, and what I'm hearing is concern that in Fairfax County, I know that apparently we do English and Spanish, but not Korean and Vietnamese and so forth. And so we've got a language and a culture challenge for many of our newer residents who are fearful of a lot of things, including what happened last Wednesday, but are fearful even of trying to access the vaccines. My question for Dr. Goodson is the discussion about flu shots. I'm really concerned about the capacity that we would have, because I suspect that many people do not get flu shots. Some do, but a lot don't. Everybody seems to want to get the vaccine. So would we be setting ourselves up sort of as with some additional capacity problems by assuming that just bringing in pharmacies and doctors' offices, who I know my own doctor is ready, willing, and able to vaccinate his patients, but he doesn't have access to the vaccine, and there's no information about how to get that. So, how many people? I mean, what is the gap between folks who normally get a flu shot and know those who must have a vaccine? That's something I think we have to take into consideration. Let's not overwhelm an already overwhelmed system by assuming that there are partners out there, because even though they want to help, they may not have the capacity. Thank you.
Yeah, and that's a good question, because particularly in the winter, a lot of our outpatient medical offices are busy. Now, hopefully, we're going to have a mild flu season because of the mitigation steps we're taking to protect us from COVID. It's still early in the season, but we really haven't seen much flu, at least in Loudoun County. And hopefully that'll help. But talking to some of our urgent care centers, they're pretty busy right now. So outpatient provider offices are limited. What the nice part would be is if they did have that capacity, that when they're seeing someone for another reason, give them the COVID shot while they're there, which would be helpful. Our pharmacies, though, are not that busy now. And for a lot of vaccines, other than COVID, they could be postponed. We're past the flu vaccination peak. That's typically October, November, December, where people are most likely to get their flu shots. The other piece, and we need to get the word out better on this, is you don't want to have another vaccine within 14 days, either before or after the COVID vaccine. So if people are really wanting to get their COVID shot, maybe they'll put off their routine tetanus booster until the summer instead. The other piece that's helpful is that there's funding attached to this. And so folks can charge the administrative fee. There's not a cost for or charge insurance, the administrative fee. There's not a charge for the vaccine. So we are seeing an interest in pharmacies stepping up to the plate. There is a delay in the process of getting them authorized to be able to utilize the vaccine. And so that's what we're seeing now as one of the barriers that we're going through, as those pharmacies are going through that application process with the CDC so they can receive the vaccine. But I think whether that's people getting vaccinated at the pharmacy or the pharmacy vaccinators going out into the community, I think that really is an added value. But still with it, I think, as folks have said, we're going to have limitations on vaccine, and we're going to have limitations on everybody trying to get it at once. And that's the value of the prioritization system. But we understand that given the impact of coronavirus, no one wants to willingly wait 1 or 2 months to be next in line. Everyone wants to get it today. So I think that's driving a lot of what we're going through, all the people who've been waiting for so long. And unfortunately, not on a local level, but I think it has been sold as the panacea, that once vaccine comes along, the pandemic is going to go away and everyone will get their shot and be happy. And hopefully, I'm looking at Chair Randall, though she can't see me, and Supervisor Briskman. Hopefully, every time I've talked to them, I've let them know that there are going to be starts and stops to this. It's not going to be pretty, and we're going to get through it. But dealing with people's expectations is really a challenge now.
Well, thank you. I just want to, again, let's not forget the language barriers and the cultural barriers that many of us are facing for our constituents in Northern Virginia. Thank you so much.
Thank you, Mr. Dorsey.
Thank you, Mr. Chair. I wanted to just address the sort of point that Ms. Gross left us with, and it's a suggestion. It's something that we're trying in Arlington, which may be helpful to those of you across the region. We are repurposing our complete count committee from the census into a complete vaccination committee so that we can get those trusted partners that we develop for the census effort to be out there in the community so that we can bridge language, cultural, and maybe hesitance to vaccine barriers that might exist and not have it be on government, who may not necessarily be the best messenger. So we don't have any, concrete results that I can share with you, but on paper, this is a really promising concept. Fortunately, those folks had not disbanded or gone too far. And so we were able to resuscitate them pretty quickly, and they're out there so that when we, hopefully solve all the problems of logistics and cold storage and adequate supply, that we actually have a willing community that's going to, get us to herd immunity.
Great recommendation. Thank you for that. Mr. Wolf, I think you had a question?
Not a question, but I wanted to thank the doctor. This parrots a presentation we had from Prince William Health's director on Monday night. And there were a couple of takeaways. And first off, I want to agree with Mark. We can't affect supply. Prince William County, through early this last week, it only received 5,000 doses from 500,000 people. So that's out of our control. What became very apparent when talking to Prince William Health, and I throw this out because I don't know the situation in other jurisdictions, is mass vaccination requires very large facilities because of the spacing that's needed to maintain safety. And there is a somewhat of a lack of communication between the health departments and the local governments in terms of reaching out and actually securing facilities. We just opened up a school and they were like, oh, it really made a huge difference. We didn't really know. It sort of seemed as something of a surprise. And I turned to the doctors like, I'll open up every school in the city if that's what it takes to get people vaccinated. You just got to tell us. And realizing there's issues in capacity and staffing on the health department side, but we have the facilities that can enable this. And I think too often there's obviously a lack of communication and coordination between the health departments and the localities. The second thing gets back to communication. That's an area where we can really drive the ball here, both as individual governments and COG as an organization. There is a tremendous lack of communication with regard to the vaccines, all the different parameters. Are you 1A, 1B, whatever, however it's going to evolve. And we have repurposed our public information officer to focus pretty much only on this in all of our communications coming out from the city so that our citizens and in the surrounding community will be aware. So we've made this absolutely priority number one and put everything else in the back burner from a communications perspective.
Yeah, and I appreciate that if I can chime in. And I think you raise a very good point. And as I mentioned, our county's EOC has been in operation since March. And every day we have a policy meeting, which is led by our CAO, and which to me is one of the greatest ways that we get things done in this, because I know that our CAO, one, knows everything that's going on with the health department and all our issues related to this. But in addition to that, it's not infrequent that after we get off that half an hour policy meeting, I'll get a call from one of the other department heads or subject matter experts saying, as soon as we were done, Mr. Hemstreet came to me and said, you got to fix this. And we'll get more resources. We'll have a release that goes out. And as I said, it really helps with that all of government approach to have that ability to have each key area of the county, including the health department, be there every day, sharing where we are and what needs to be fixed and accomplished. And to your point, we have our one pod that stood up because we had to get something done quickly, but it's not an ideal pod. So we said, okay, it's cold in there, and so Mr. Hemstreet said, hey, we got to fix that. And when the CAO talks, things happen pretty quickly.
Given the subject matter of vaccines, I have to imagine that there's going to be more briefings on this matter. So I think we'll, as the vaccinations roll out, there'll be more challenges, more questions, and we'll pull more folks back into the meeting to answer questions. With that, we're just slightly behind schedule, but are there any more? Is there maybe one more pressing short question for Dr. Goodfriend before we let him go? None, even better.
Just one last thing, saying, I've been speaking from my point of view. I know every jurisdiction is different. We have, as I said, we have more coordination within Northern Virginia, but I would ask you to reach out to your health officials if you have questions about what's going on, what their priorities are, and their solutions are, because easily they're a bit different from how we're approaching it in Loudoun. So thank you.
Thank you very much, Dr. Goodfriend. Very, very helpful, and we appreciate you sharing your experiences with us. We now move to agenda item 12, the regional approach to preventing and ending homelessness. This is our final item for the day. And we will hear from my friend and colleague, Councilmember Brianne Nadeau, who represents Ward 1 on the DC Council, on behalf of the COG Human Services Policy Committee, about the committee's collaborative response to prevent and end homelessness through a regional compact. Following up on Councilmember Nadeau's presentation from our November meeting, the board will be asked to adopt Resolution R12-2021, endorsing expansion of regional coordination efforts to prevent and end homelessness. With that, we'll turn it over to Councilmember Nadeau. Welcome.
Thank you, Chairman, and congratulations to you and the new officers. And it's nice to see all of my colleagues from the Human Services Policy Committee today. I want to be mindful of your time. So I'll dive right in. I'm the District of Columbia Councilmember Brianne Nadeau and the 2020 Chair of COG's Human Services Policy Committee. During the November 2020 COG Board meeting, I was able to share with you the background and context for the HSPC work priority focus and its desire to highlight solutions for housing stability and regional cooperation to prevent and end the experience of homelessness. Regional continuums of care are facing unprecedented needs for staffing, additional shelter facilities to ensure safe social distancing, healthcare coordination and support, COVID testing, and permanent housing for people experiencing homelessness. And because no one jurisdiction can solve homelessness on its own, our need to coordinate regionally has never been more critical. With input from an HSPC subgroup and the COG Homeless Services Committee, members have drafted a regional compact to prevent and end homelessness that we're presenting to the COG board today in the form of a resolution for adoption. We understand that some jurisdictions may be especially stretched at this point. Therefore, this compact is open to jurisdictions who are both interested and able to participate, allowing for additional jurisdictions to sign on over time. We'll go on to the next slide. HSPC's goal is for the region to work together collaboratively to prevent and end the experience of homelessness. To achieve this goal, the HSPC has proposed a regional vision and mission. You see that before you on the screen for those who may be calling in. The vision is to create a cross-jurisdictional, client-centered approach to ending the experience of homelessness by identifying and breaking down barriers to get people to the resources they need. The mission, by openly sharing and analyzing data across jurisdictions and coordinating cases, we can identify gaps in both emergency shelter and housing and effectively advocate for resources to bring an end to homelessness in the Washington metropolitan region. Next slide, please. Thank you. To achieve this regional vision, the HSPC recommends jurisdictions consider implementing 5 actions. I'll describe the first 2 here in greater detail. First, the HSPC recommends that jurisdictions consider building upon the existing data sharing agreement between the District of Columbia, Montgomery County, and Prince George's County to include the other COG member jurisdictions. This would allow us to better match client needs with the appropriate resources to resolve their homelessness. And second, developing regular reporting metrics, such as through a dashboard that would help communicate to COG board members and the general public about the regional scale of homelessness. COG's Homeless Services Committee is beginning to develop this framework, starting with our regional point-in-time count data. Next slide, please. The remaining recommended actions include regional tracking and case coordination, residency requirement alignment, and maintaining a racial equity focus. So the third item, regional tracking and case coordination, this recommendation involves developing a regional protocol to identify residents who may be on multiple coordinated entry priority lists for permanent housing. Having an ability to share data across jurisdictions is critical to the success of this strategy. Number 4, residency requirements. The HSPC recommends that jurisdictions consider aligning residency requirements across the COG region to ensure that people are better able to have their housing needs met where they are. And number 5, the last recommendation is to ensure that our work to end homelessness is grounded in racial equity. To achieve this goal, the COG Homeless Services Committee is engaging the assistance of outside consultants to prepare a region-wide homeless systems audit. This audit is designed to ensure that efforts to prevent and end homelessness are grounded in racial equity and existing structural inequities are not compounded within the current systems of care. A consultant is expected to be selected by the end of this month with recommendations available during the first quarter of 2022. Next slide, please. Right. So to achieve the regional vision, the HSPC recommends that the COG board adopt the proposed resolution and support members of the region's continuums of care represented in COG's Homeless Services Committee to be able to implement these recommendations successfully. Those actions are listed again here on the slide before you now. During 2021, the next steps the Homeless Services Committee members will take to achieve this mission include the following. First, working on creating a regional data dashboard, starting with the point-in-time count data, and explore how to expand an existing data sharing agreement. 2, develop a regional protocol to identify residents who may be on multiple coordinated entry priority lists for permanent housing to most efficiently resolve a person's experience of homelessness. 3, after procuring a consultant, COG will prepare a region-wide homeless systems audit to ensure that efforts to prevent and end homelessness are grounded in racial equity and existing structural inequities are not compounded within the current systems of care. Let's see. And the process of selecting a consultant is underway and anticipated by the end of this month. The project's expected to take 12 months, and we look forward to reviewing and sharing the recommendation in the final report with the Human Services Policy Committee, as well as the COG board in the first quarter of 2022. I very much appreciate your time, and I hope to gain your support for this important work, and I'm happy to take questions at this time. The resolution itself should be in your board packets, and I don't know if it ended up inserted into this presentation or not in the end, but if so, we can probably put it up on the screen if folks want to see the full text on the screen as well. Thank you, Chairman.
Thank you very much, Councilmember Nadeau. Are there any questions? And if we pull down the screen sharing, it would make it easier for me to see the participants. Or you could just yell out your name.
Mr. Chairman, this is Penny Gross. I do have a quick question.
Yes, Ms. Gross.
Brianne, I'm glad to see all this come together after the enormous amount of work that you've put in on this over the last couple of years. Remind me of the budgetary implications for COG that this might have. even just in the consultants piece or the work of the staff? Is there a budgetary implication?
I'm going to defer to Hillary on this piece regarding the consultants.
Thank you.
Sure. Good afternoon, and thank you, Supervisor Gross, for your question. We have been working actually for 2 years to raise the funds for this work. The budget for this consultancy has been earmarked in the HUD COC NOFA planning grant application that was submitted in 2019. So a portion of each jurisdiction's COC planning funds have been earmarked specifically for this purpose. We were also very grateful to receive a grant from the Greater Washington Community Foundation to fill the gap, to be able to allow us to move forward with the procurement. Sorry, and for COC, not a Chamber of Commerce, that means Continuum of Care, sorry.
Thank you. Thank you very much. Mr. Chairman, just as an aside, when I first joined the COG board many years ago, there was a council member from Montgomery County, I think her name was Gail Estia, I can't remember for sure. And one of her favorite questions was on any of these kinds of resolutions was to ask for the budgetary implications. It's a lesson I learned a long time ago, and I want to sort of hand that off to others who may be joining more recently, because we do have to keep in mind all the time the budgetary implications of anything we try. I support this fully, but we do need to make sure that the dollars are there. Thank you.
Thank you for that. Are there any other questions from members? All right, hearing none, I want to thank again Councilmember Nadeau for your continuous commitment to this important issue. At this time, we will move Resolution R12-2021, endorsing expansion of regional coordination efforts to prevent and end homelessness. Is there a motion and a second?
So move, Supervisor Bailey.
Thank you.
Second, Chair Randall.
Moved and seconded. Are there any nay votes or abstentions? Hearing none, the motion passes. We will now move to agenda item 13, where we will be in executive session. This is a closed session. Everyone other than COG board members and selected COG staff are required to leave the virtual platform. Executive session